Yeah. So thank you, Chairperson sir. Thank you, Team BDCon, for inviting me for this very pertinent topic. So after two back-to-back core endocrine topic, my job is relatively easier, but again, it's very important for our day-to-day clinical practice. So before I start, may I have a raise of hand? How many of you routinely advise vaccination for your diabetic patient? 3, 4, 9, 10? Semi-routinely, okay, that should be the correct term. Okay, so a lot of hands. So I think it is very important to know the updated guideline for the same. So in this realm of comprehensive diabetes management, holistic management, vaccination is again a small part in the whole diabetic management. And it has gotten momentum after the COVID-19 vaccination. People know what vaccination is. They know how it can change the clinical course. The two main important aspects why we vaccinate is number one, prevention of an infection. And number two, even if we cannot prevent it, the severity is reduced. Let's say somebody who has gotten influenza vaccination, he may not be totally immune to the influenza, but the severity of infection, the hospitalization comes down. In this perspective, I found two guidelines recently published. One is 2024 in India, both are from India, and another is 2025. So for next 10-15 minutes or so, I will be discussing all the data that I found from these guidelines. Obviously, we have guidelines from ADA, which I'll show later, but possibly the Indians are more pertinent to us. Now, before I start the individual vaccines, let me explain the types of vaccine. One is a live attenuated vaccine where the antigenicity is reduced, but immunogenicity is maintained. Another is a conjugate vaccine when a portion, a particle point of whole virus or whole bacteria is given against which immunity is developed. Obviously, live attenuated vaccine have less antigenicity, but not 100% foolproof. That is why it cannot be given to pregnant mothers or those who have less immunity power. However, conjugate vaccine is relatively safer. It cannot cause the disease itself. Now, why diabetes is special mention? Because all of us know diabetes is an immunocompromised state, especially if it is uncontrolled. But it has been shown your diabetes, if it is moderate, it is controlled, they have adequate immune response to vaccination. So their immunogenic power is at par with those without diabetes. But there are some theoretical concern whether in uncontrolled diabetes where the immunity power is low, the vaccines do have similar immunogenicity or not, but the guidelines are not very clear that at what A1C level we can advocate vaccine. But to our clinical experience, we usually do not prescribe it to a patient with HbA1c of 12. After reasonable control, then only vaccine should be administered. So I'll be discussing 6 important vaccines today and 1-2 more vaccine that's for theoretical concern. One is pneumococcal, then is influenza, hepatitis B vaccine, Tdap vaccine, zoster, and COVID. Let me start with the pneumococcal vaccine. So there are 2 types of pneumococcal vaccine. Pneumococcus is a bacteria, right? So pneumococcal polysaccharide vaccine or PPSV is the first one. This PPSV is against 23 strains. So it is also called a PPSV 23 vaccine. Another is a conjugate vaccine. It has a polysaccharide conjugated to a carrier protein that enhances the antibody response. More antibody production is there, but it covers only 13 strains. So we have PPSV 23, more strains, less immune response. We have PCV 13, lesser strain, but greater immune response. In between, there is PCV 15, which is yet to come in India. That is possibly going to be the best vaccine, but we do not have it in our hand. Now, how effective is a pneumococcal vaccine? It has been shown, as I previously mentioned, it reduces the hospitalization risk as well as the total death, and that's why the systemic reviews do recommend it should be given. Now, when I asked everyone that how many of you routinely prescribe, I saw at least 30% in this hall raise their hand. But if you see the worldwide data, except from the Western few countries, the whole world is not doing so. Even we have our own data, and that is also less than 1% people are getting pneumonia vaccine in diabetes. So we are missing opportunity And the main reason is behind that is in the recommendation in routine care, most of the diabetic guidelines do not advocate vaccine properly, right? So these are the ADA guideline. Let me focus the Indian one. So Indian guidelines, they do recommend. We have two vaccines, as I said. One is PPSV 23. I've written the trade name as well because that's the only vaccine available now. There is Pneumovax 23 and we have Prevnar 13. So for the age group of 19 to 64 year, we need to give mostly PPSV. However, if PCV 13 is taken, then you can give a PPSV 23 at least 1 year after that. But for those who are more than 65 years of age, we need to give both the vaccine. First PCV 13, we need to build up more immune response. After 1 year, we can give a PPSV 23 to improve the strain number. And do these vaccines need a booster dose? Yes, if your age is above 65, you can revaccinate after 5 years. But it's not clear below 65 years. Possibly we do not need, but once the patient you have given at age of 50 now crosses 65, it's better you give a PPSV 23 at that time, right? So these are the two vaccines, Prevnar 13 and Pneumovax 23 that are currently available in India. Coming to the influenza vaccine. Influenza is a virus, right? So it can affect the same individual repeatedly, and the major mechanism behind that, it changes itself very frequently. The antigenic shift and drift, they go rapid evolution, and that's why it evades the immune response of an individual. So that's why you can have influenza 3 times, 4 times in a year, and year after year you can have influenza. So that's why there are a lot of strains actually, and all the strains changes frequently. So here this vaccination, what is important, yearly updated influenza vaccine. So the vaccine we advocated in the year of 2023 will not be the same that we will prescribing in the year 2025. And that's why again, there are two types of vaccines, live attenuated and inactivated. Live attenuated is not recommended for diabetic patient because it still contains some antigenicity. Right. So the current available today, it is Influvac Tetra, and it has shown 2024, 2025. The name they have given this. Last year, it was Influvac Tetra 2024. So this year, the vaccine changed because they are changing the strains that are included in this vaccine. This vaccine has reduced the risk or hospital visit by 40 to 60%. And what's the recommendation? That any person who is 6 months or older can get an annual vaccination, influenza vaccination. And it's relatively cheaper than the pneumonia vaccination, and it can actually help, especially in diabetic individual, for less hospitalization. So yes, influenza vaccination yearly. But how much we are actually given this vaccination? This was a study from South India. One of my senior, Beatrice ma'am, she had evaluated 388 patients with diabetes who came to the OPD before entering the consultation room. When they are sitting, they just give a format, a paper, just tick whether you know about vaccination. You'll be astonished to know that it was only 0.5 and 0.7 of people were vaccinated. Great, less than 1% that I was discussing. And more so, the knowledge was less than 5% of the patient. So 95% of the diabetic patient don't know about vaccination, forget about taking them, right? So there is something which we can improve a lot. Coming to hepatitis B vaccination, again, this is something which I believe everyone in this room has taken when they entered the MBBS life. At least in our college, everyone in the first year MBBS were given hepatitis B vaccination. We all know it's transmitted by fetal-maternal, sexual or transdermal, and vaccine is a very effective mechanism by which we can actually prevent the infection. The vaccine's safe, affordable and effective. However, efficacy drops as the age progresses, mostly due to poor compliance. There are 3 doses, 0, 1 and 6 months. So the Indian guidelines, they suggest 3 doses should be given, 0, 1 and 6 months, and all adults actually basically should be given. But at least in our clinical practice, we recommend this vaccine for those who are awaiting dialysis, before giving dialysis, where they might need repeated blood transfusion, repeated injections. So there we usually recommend, but ideally everyone should be given vaccination with hepatitis B. Coming to the Tdap vaccine, personally speaking, I actually never prescribe them, but let us see what do the guidelines suggest. It's a previously called DPT vaccine, it's now Tdap, tetanus, diphtheria and pertussis. These three vaccination and this evidence pertaining to the diabetic population is very scarce, but to be safe from the risk of infection, the organizations, the diabetic organizations, they do recommend vaccination with Tdap for patients living with diabetes. This is the Indian guideline, 0.5 ml. All adults have to have a single dose, pregnant individual to have an extra dose, revaccination every 10 years. So these are the all other guidelines in the diabetic and non-diabetic as well. CDC I have also shown, they do recommend this vaccination for all adults. This was an eye-opener for me as well, that yes, we need to give this vaccination for all, and this is a cheap vaccine. The cost is in the range of 1,000 only. So Tdap vaccination for all individual, especially in diabetes. Coming to the next vaccine, the shingles, the zoster vaccine. The name of the virus is the varicella zoster, right? And the disease it causes is chicken pox, mostly in the young age, called varicella, and reactivation of it called herpes zoster, that is shingles, right? So the vaccine is to mostly prevent the herpes zoster, the shingles one, and it has been shown those who are diabetic, especially in the elderly population, have 38% higher risk for reactivation. And we all know that reactivation occurs for those who are immunocompromised. It was seen in HIV, AIDS, in patients with diabetes or any region, elderly people having less immunity, the herpes zoster, the reactivation occurs. And vaccination is the only method to achieve protection against shingles. Again, there are two types of vaccination. One is live attenuated and is a recombinant. And as earlier I also described, the recombinant vaccine, the component vaccines are more efficacious as compared to the live attenuated one. And in immunocompetent people, the vaccination efficacy is 84% compared to 49% with the live vaccine. So again, it's a recombinant vaccine which is recommended. So zoster vaccination, how we should give? It's a 0.65 ml vaccination for all adults with diabetes more than 50 years of age. We should give it. The second dose, the booster dose, should be given 2 to 6 months after the previous dose. Well, another vaccine. So much less what we'll spend about the COVID vaccination, because everybody has gone through the phases of COVID vaccination. It was a huge, I don't know whether success what will be the correct one, but it was rolled over all over the India efficiently and with the method of electronic methods, reminders and compelling indications for travel. Those things made it a huge success for the vaccination part. So I'll not go to the details of COVID vaccination because I think everybody already has taken that. So the problem in vaccination in India, in pediatric population, we have seen significant progress. We have IAP modules, we know guidelines. Every child at least takes some vaccination even if they don't complete it. But for adults, the communication and promotion of adult vaccination remains inadequate, leaving a substantial portion of the adult population vulnerable to infection. Yes, cost is definitely an issue because these are mostly out of the pocket. Government do not have any scheme for adult vaccination. And sometimes there is hesitancy even from the patient part as well as from the doctor part. And the reason behind that inadequate education, inadequate awareness, that is creating the problem. Even if in this hall today we know a lot of people listening to this talk will know the benefits of vaccination, but when we are in practice, still we will hesitate because of some affordability concern. We need to see so many things in a diabetic patient, starting from sugar, pressure, cholesterol, all comorbidities, all complications. After that, very few time remains for the vaccination counseling. And accessibility again remains an issue because these vaccines needs cold chain until it reaches to the patient. So how we can improve? We can improve by increasing the educational sessions by physicians, doctor, and in the patient part we can use social media, we can use the newspapers, outreach camp where different health camps are organizing. There we can keep the benefits of vaccination. Involving more epidemiological studies, more data will draw more attention, will take more guidelines, and government undertaking for cost cutting, because most of the vaccines are privately manufactured and they are much costlier. Effective management of electronic health record, as has been seen in COVID vaccination, the reminders, the recall for boosters can again be beneficial. And involvement of religious leaders, I don't know how much efficacious that can be, but we as a doctor should lead the path and discuss with our patient, not once but repeatedly, to understand why vaccination is important. So these are the ADA guideline, which I individually has described: the influenza, pneumonia, hepatitis. HPV is another vaccination that is not particular to the diabetes, but any human less than 26 years or even at 27 to 45 can take HPV vaccines. The Tdap and zoster all are there in ADA guideline. So to conclude, that vaccination is an indispensable cornerstone of diabetes management. It is a part of the holistic management that we are recommending today. It reduces infection, not only reduce, even if it cannot reduce, it prevents severe complication and fatal outcome. Safeguard against influenza, pneumonia, hepatitis, shingles, Tdap and COVID already on board. Guidelines and expert group recommendation from India are already there, but needs more awareness, more discussion regarding this topic, and this awareness of vaccination is much needed. So I thank Team BDCon to keep this topic for my discussion, and I think I tried to instill the habit of vaccinating your diabetes patient in your next chamber. Thank you.
Thank you, Subhodip.